Hello, my name is Mark Sherman. I'm a general surgeon practicing at Surgical Associates of La Jolla. That's the name of our medical group. Right across the parking lot is Scripps Memorial Hospital in La Jolla. Just a few minutes to talk to you about thyroid disease and specifically thyroid cancers and thyroid nodules. There are some individuals who have found, or their doctors have found, a little nodule on their neck in their thyroid gland. Now, the thyroid gland sits on the neck a little bit like a butterfly or maybe a moth because the body is a little bit bigger. But there's a left lobe, a right lobe, and then the isthmus of the thyroid is kind of like the body of that moth that's landed on right across your windpipe, the larynx. The thyroid gland is a critical gland in terms of the body's overall metabolism. Regulation of that gland is closely controlled by the body, and some individuals develop a nodule or even multiple nodules in their thyroid gland. In some cases, in fact in many cases, those are benign. But in some cases, there can be thyroid cancers that are there. So one of the things that we do to look at this is ultrasound. That's using sound waves and allows us to measure the size of those nodules. But we look at more than the size. Are there calcifications? Are there blood vessels in there that shouldn't be? Does it look irregular? Has it grown compared to your last thyroid ultrasound? And if there's changes, if there's anything that makes us a little bit concerned, the next step often is a fine needle aspiration. And what a fine needle aspiration is, it's a type of biopsy. What we do is with an ultrasound probe, we can see the nodule and guide just a small little needle right into that nodule and sample some of the cells. Now, go back 40 years ago, it was pretty hard to determine what was going on in there just by looking at a few cells. Our pathologists have actually advanced quite a bit through the years in terms of the techniques and studies that are available to them, so that now they can look at these cells and give us really a better idea, is there a cancer that's there? Unfortunately, sometimes it's really just a percentage. Is this likely to be a cancer or not? But now we even go one step further. We can actually take those cells, send them to a lab that looks at the DNA, the actual genetics of those thyroid cells, and those studies can give us an even more detailed analysis and a more accurate assessment of the risk for a cancer. In some cases, those studies will say the chance of this being a cancer, only 5%. And we can kind of follow you and watch and make sure that that nodule doesn't grow. But in some cases, they'll tell us that the risk of a cancer is pretty high, and you may need a thyroid operation to truly clarify that and to treat that. And that's something that we would be able to do for you in our office. We work with our radiology colleagues who can perform the biopsies. We work with our pathology colleagues. We work with our endocrinology colleagues. Really, an entire team that is here at your disposal to allow your thyroid cancer nodule to be evaluated in the best way possible and for you to get the best treatment possible. If you have any questions, please call our office, look at our website, or check our YouTube channel. Thank you.